Seniors, what's the best blood pressure for older adults? Know the truth. The quest to understand optimal health as we age often feels like navigating a labyrinth, especially when it comes to vital indicators like blood pressure. For years, the medical community has presented a seemingly straightforward set of numbers, a universal benchmark that many seniors strive to meet, often through a regimen of daily medications. Yet, what if the conventional wisdom, the widely accepted best blood pressure, isn't telling the whole story, particularly for those in their golden years? What if there's a crucial, often overlooked nuance, a deeper truth that could fundamentally change how you approach your cardiovascular health, empowering you with knowledge that extends far beyond a simple prescription? This isn't just about managing a number, it's about understanding the intricate symphony of your body, recognizing its unique needs, and discovering an approach that truly aligns with natural, sustainable well-being. The implications of not knowing this truth are profound, potentially leaving you locked into a cycle of anxiety and reliance, missing out on the vibrant health and clarity that comes from a truly informed perspective. Many are unknowingly sacrificing their energy, their cognitive sharpness, and even their long-term vitality by adhering to a narrow interpretation of what constitutes normal or best blood pressure in older age, when a more holistic, personalized understanding could unlock a vastly different and healthier path. You absolutely cannot afford to miss this critical insight, because what you don't know right now could be silently impacting your future health and quality of life. The time for a superficial understanding is over. It's time to uncover the deep-seated wisdom that has been overlooked for too long. The pervasive fear surrounding high blood pressure or hypertension is well-founded, given its link to serious conditions like heart attack, stroke, and kidney disease. However, for older adults, the landscape of blood pressure management is far more complex than a simple "lower is always better" mantra. The aging body undergoes unique physiological changes that influence blood pressure readings and their interpretation. Arteries naturally stiffen with age, a process known as arteriosclerosis, which can lead to higher systolic, the top number readings, even in otherwise healthy individuals. Furthermore, the delicate balance of fluid regulation and kidney function shifts, impacting how the body handles sodium and water, both crucial determinants of blood pressure. A blanket recommendation, therefore, risks over-treating some and potentially neglecting more profound underlying issues in others. This nuanced reality is precisely where many people, especially seniors, are left in the dark, leading to a profound sense of frustration and often unnecessary medical interventions. Failing to grasp these specifics means you could be making decisions based on incomplete or even misleading information, decisions that could inadvertently compromise your well-being. One of the most significant overlooked insights lies in recognizing the individual variability of what constitutes optimal blood pressure in later life. While a general guideline of 120/80 mmHg is often cited for younger adults, rigid adherence to this standard for someone in their 70s, 80s or beyond may not only be unrealistic but potentially detrimental. Extremely low blood pressure, hypotension in older adults can be just as dangerous as hypertension, leading to dizziness, falls, fainting, and reduced blood flow to vital organs like the brain and heart. This can impair cognitive function, diminish energy levels, and significantly impact independence. The critical secret here is that a slightly higher blood pressure, perhaps in the range of 130/140 systolic, might actually be more protective for some older individuals, ensuring adequate perfusion to the brain and other organs when standing up or exerting themselves. This personalized perspective is often lost in the drive for standardized targets, creating a profound disconnect between general medical advice and the lived reality of an aging body. You need to understand this distinction now, before a misunderstanding of your own numbers leads you down a path of misguided treatment. Moreover, the phenomenon of white coat hypertension, where blood pressure readings are elevated in a clinical setting due to anxiety, is disproportionately prevalent in older adults. Conversely, masked hypertension, where readings are normal in the clinic but high at home, also presents a significant challenge. These situations highlight the critical importance of home blood pressure monitoring, not just as a casual check, but as a consistent practice to gather meaningful data that reflects your true physiological state. However, even with home monitoring, the method, the device, and the interpretation of the readings are paramount. Are you taking readings at the same time each day? Are you relaxed, seated correctly, with your arms supported? Is your cuff size appropriate? These seemingly minor details are the bedrock of accurate measurement, and without precision here, even the most diligent monitoring can yield misleading results, leading to unnecessary worry, or worse, a false sense of security. The true utility of understanding your blood pressure numbers hinges entirely on how you obtain and interpret them. And the vast majority of people are missing crucial steps in this process, potentially jeopardizing their health outcomes. Barbara O'Neill, a prominent voice in natural health and holistic wellness, often emphasizes the body's incredible inherent capacity for self-healing and regulation, providing a vital counter-narrative to the often symptom-focused approach of conventional medicine. Her perspective encourages individuals to look beyond mere numbers and delve into the root causes of physiological imbalances, advocating for a foundational shift in lifestyle rather than a perpetual reliance on pharmaceutical interventions. This is where the true power of overlooked insights resides. Instead of simply masking symptoms with medication, her approach invites you to investigate why your blood pressure might be elevated. Is it chronic stress, dietary choices, lack of physical activity, poor sleep, dehydration? The answer is rarely singular, often involving a confluence of factors that, when addressed holistically, can lead to sustainable improvements without the side effects often associated with medications. This holistic paradigm represents a significant departure from mainstream thought, offering a path to genuine vitality rather than mere disease management. Ignoring this foundational truth means perpetually addressing the symptoms without ever solving the puzzle. Let's delve deeper into these foundational factors, because this is where the actionable secrets lie, empowering you to take control. Nutrition stands as a cornerstone. The standard American diet, SADI, laden with processed foods, excessive sodium, unhealthy fats, and refined sugars, is a primary culprit in the global hypertension epidemic. Shifting towards a whole food, plant-centric diet, rich in fruits, vegetables, whole grains, and lean proteins can have a profound impact. Specifically, potassium-rich foods like bananas, leafy greens, avocados, and sweet potatoes help to counterbalance the effects of sodium and promote vasodilation, easing pressure on arterial walls. Magnesium, found in nuts, seeds, dark chocolate, and legumes, is another critical mineral that supports healthy blood vessel function and relaxation. The inclusion of nitrates from beetroot, antioxidants from berries, and allicin from garlic are all natural vasodilators and anti-inflammatories that contribute significantly to a healthier cardiovascular system. The secret here isn't a miraculous herb, but the consistent, intelligent application of well-understood nutritional principles that most people overlook in favor of quick fixes. Your body is constantly regenerating, and the building blocks you provide dictate the quality of that regeneration. Beyond macro and micronutrients, the impact of proper hydration is frequently underestimated. Water is fundamental to every bodily process, including blood volume and viscosity. Chronic mild dehydration can lead to thicker blood, which the heart then has to work harder to pump, potentially elevating blood pressure. Ensuring adequate, pure water intake throughout the day is a simple yet powerful intervention that costs virtually nothing but offers immense benefits. Many older adults inadvertently restrict fluid intake due to concerns about incontinence or frequency of urination, unaware of the cascading negative effects on their cardiovascular system, kidney function, and overall vitality. This seemingly innocuous habit, or lack thereof, contributes significantly to the burden on the heart and circulatory system, a silent stressor that can push blood pressure higher. This is one of those foundational elements that is so simple, yet so often ignored, and the cumulative effect of ignoring it can be immense. Missing out on understanding the critical role of water means missing a fundamental piece of the health puzzle. Physical activity is another non-negotiable component of optimal blood pressure management, particularly for seniors. Regular, moderate exercise, tailored to individual capabilities, strengthens the heart muscle, improves arterial flexibility, helps manage weight, and reduces stress hormones. It doesn't require grueling workouts. Even consistent brisk walking, swimming, cycling, or Tai Chi can yield significant benefits. The secret isn't about running marathons. It's about consistency and finding activities you genuinely enjoy, making movement a joyful part of your daily routine rather than a dreaded chore. Many perceive exercise as a young person's game or something only for fitness fanatics, but the gentle, sustained movement that optimizes cardiovascular health is accessible to almost everyone. The real magic happens when exercise becomes a consistent habit, a cornerstone of daily life that signals to the body its need for strength and vitality, thereby directly influencing arterial health and blood pressure regulation. Don't let the misconception that you're too old or too out of shape prevent you from unlocking this powerful natural therapy. Perhaps one of the most insidious yet pervasive factors influencing blood pressure is chronic stress. The constant activation of the fight or flight response floods the body with hormones like cortisol and adrenaline, leading to constricted blood vessels, increased heart rate, and elevated blood pressure. While acute stress is a natural survival mechanism, chronic stress, often stemming from financial worries, relationship issues, caregiving responsibilities, or even simply the pace of modern life, creates a perpetual state of physiological arousal. Learning effective stress management techniques, such as deep breathing exercises, meditation, mindfulness, spending time in nature, engaging in hobbies, or fostering strong social connections, is not a luxury. It is a vital component of blood pressure control. The overlooked insight here is that you cannot medicate away a stress problem. You must address the stress itself. Many people are trapped in a cycle where stress elevates blood pressure, leading to medication, which doesn't resolve the underlying stress, creating a perpetual state of worry and pharmaceutical reliance. This cycle is precisely what you need to break free from, and the knowledge to do so is within reach. Sleep hygiene, often overlooked in the flurry of health advice, plays a monumental role. During sleep, your body repairs itself and your blood pressure naturally drops. Chronic sleep deprivation disrupts this restorative process, leading to sustained elevated blood pressure and an increased risk of hypertension. The quality and duration of your sleep are as critical as your diet and exercise. This means prioritizing 7 to 9 hours of uninterrupted sleep, creating a conducive sleep environment, dark, quiet, cool, and establishing a consistent sleep schedule. The secret is not just about getting enough sleep, but getting quality sleep that allows your cardiovascular system to fully rest and reset. Missing out on addressing your sleep patterns means missing a fundamental opportunity to support your heart health naturally and effectively. The link between poor sleep and hypertension is far more robust than many realize, representing a silent contributor to cardiovascular strain. Weight management, particularly around the abdomen, is another critical factor. Excess visceral fat, the fat surrounding internal organs, is metabolically active and releases inflammatory compounds that negatively impact blood pressure and overall cardiovascular health. Losing even a modest amount of weight, even just 5 to 10% of your body weight, can significantly lower blood pressure and reduce the risk of associated complications. This isn't about achieving an idealized body shape, but about reducing the physiological burden on your heart and circulatory system. The synergistic effect of a healthy diet and regular exercise is the most sustainable path to achieving and maintaining a healthy weight, thereby alleviating one of the most significant stressors on your blood pressure. The truth is that carrying excess weight, especially as we age, places an undeniable strain on the entire cardiovascular system. And addressing this factor offers one of the most profound opportunities for improvement. Furthermore, environmental factors, though often less discussed in direct relation to blood pressure, play a subtle yet significant role. Exposure to air pollution, chronic noise, and even certain chemical toxins can contribute to systemic inflammation and cardiovascular strain, subtly impacting blood pressure over time. While not always easy to control, being aware of these influences encourages choices that minimize exposure, such as investing in air purifiers, seeking quieter environments, and opting for natural cleaning products. This aspect is one of the more little-known secrets, as the direct link isn't always immediately apparent, but the cumulative effect of these stressors on the body's delicate balance is undeniable. Understanding these broader environmental influences allows for a more comprehensive approach to health, moving beyond just individual habits to considering your surroundings. Understanding the implications of blood pressure medications is also a crucial, often overlooked area for seniors. While these drugs can be life-saving, they also come with potential side effects, including dizziness, fatigue, kidney problems, and interactions with other medications. For older adults, polypharmacy, taking multiple medications, is common, increasing the risk of adverse reactions. This is not an endorsement to discontinue prescribed medication without medical supervision, but rather an imperative to be an informed patient, to ask questions, to understand the purpose and potential risks of each drug, and to explore lifestyle interventions that might reduce the reliance on them over time. The truth here is that medications address symptoms, while a holistic approach seeks to correct the underlying imbalances, often with fewer adverse consequences. Being an active participant in your healthcare rather than a passive recipient is a secret weapon that empowers you to make truly informed decisions about your well-being. The concept of optimal blood pressure for seniors is not a fixed target, but rather a dynamic range that considers individual health status, comorbidities, frailty, and quality of life. For a robust senior with no other health issues, a target of less than a 130/80 mmHg might be appropriate. However, for a frail senior with multiple chronic conditions, aiming for a systolic pressure below 140 or even 150 mmHg might be more realistic and safer, preventing falls and preserving cognitive function. This individualized approach is the essence of personalized medicine and represents a significant departure from generalized guidelines. The secret is to work closely with healthcare providers who understand and embrace this nuanced perspective, advocating for a plan that genuinely serves your unique needs, rather than a one-size-fits-all prescription. This level of personalized care is often difficult to find, but it's essential for truly optimizing your health as you age. Moreover, the emotional and psychological impact of being constantly concerned about blood pressure numbers cannot be understated. The anxiety itself can contribute to elevated readings, creating a self-fulfilling prophecy. Empowering yourself with a deeper understanding, moving beyond mere numbers to embrace holistic health principles, can significantly reduce this anxiety and foster a greater sense of control and peace of mind. This shift in mindset from fear and reaction to informed proactivity is a powerful, often overlooked component of long-term health. The true truth is that your mental state profoundly influences your physical state, and freeing yourself from the constant worry about a single number can be one of the most potent therapies available. In summary, the journey to finding the best blood pressure for older adults is not about chasing a single arbitrary number, but about cultivating an intricate understanding of your body's unique physiology, embracing foundational health principles, and making informed choices that support long-term vitality. It's about moving beyond the superficial and delving into the profound wisdom that lies in holistic care. The urgency of grasping these insights now cannot be overstated. Your future health, your energy, and your independence hinge on taking action based on this deeper understanding. Many continue to struggle needlessly because they are simply unaware of these critical details. You owe it to yourself to be fully equipped with this knowledge. The information discussed here is foundational, but there's one final, critically important insight, a secret habit that 99% of people will miss, leading them to remain stuck in the cycle of misinformation and frustration regarding their blood pressure for life. You won't want to miss the final habit, as 99% will miss the last tip and will be stuck with uncontrolled high blood pressure and relentless anxiety for life. For